African Americans are bearing the brunt of the AIDS crisis here in the U.S., accounting for half of all new infections. Joining me now to talk about AIDS in the black community, Congresswoman Maxine Waters, co-chair of the Congressional Black Caucus Task Force on HIV and AIDS. Representative Waters, good to have you with us. I'm curious, do you have a personal reason to why you've been so active on this issue?
Well, first of all, it's a tragedy. We have an AIDS pandemic in the world, and African Americans are now the face of AIDS. We do represent 50% of all the new AIDS cases, and African American women represent about 70% of all of the new AIDS cases among women. And so not only am I committed to good public policy that will begin to deal with this pandemic, but I do have a personal case. I have a sister who died from AIDS. I was involved with AIDS long before she was diagnosed, but she certainly did pass away from AIDS.
Wow, so that made quite an impact on you. Did she talk to you about it? Did she say, look, you're my sister, you're a congresswoman, there's got to be something that you can do, especially within the black community? Well,
I was very much involved with her care, and I learned a lot about what AIDS patients go through. And I have given a good bill of time in the Congress of the United States to helping to increase the appropriations for minority AIDS in particular. I created the minority AIDS appropriation in the budget under Bill Clinton, where we try and get money to those communities to build capacity, to learn to respond to requests for proposal, to try and get more outreach and education. It's not enough. We've got to do more.
What's going on? Why has it reached such large numbers within the black community? Is it unprotected sex? Is it gay sex? Is it drug use? What have you found to be the main problem?
Well, first of all, let me just say that in a country as rich as America, we don't have good health outreach and prevention programs of any kind. We need comprehensive universal health care that will get people involved and taking charge of their health and learning how to be healthy, how to avoid contacting diseases. So the first problem is poverty, a lack of outreach and prevention and comprehensive health care programs where people are only seeing doctors when there's a crisis in the emergency room. Too much of that. Secondly, there's the stigma that's attached with AIDS, and the African American community is lagging in being able to take our heads out of the sand and just deal with it, to get all of the leaders and public policy makers and ministers and everybody making this a priority in their work and what they do on a daily basis. Now, for all of these reasons, that's why it's a problem.
Well, I was reading that you were saying there's a high number of men who have sex with men. MSM is what you referred to, but they don't call themselves gay.
Well, I think that, you know, in all sectors of our society, we do have men who have sex with men. I don't think the numbers are any greater in the African American community, but I think that we have not faced this issue in the African American community.
Which issue are you talking about specifically? Being gay?
No, I'm talking, well, gay, I'm talking about being gay, but the fact that men are having sex with men, it's not talked about. In our churches on Sunday morning, you have African Americans in that institution more than any place else in America. We have not been able to generate the kind of conversation, the kind of targeting on this issue that I think we should have even in our churches. So it's a matter of us taking hold of the issue, recognizing what is going on, facing up to these facts, and dealing with it.
Magic Johnson was on our show not too long ago. I don't know if you saw the interview, Representative Waters, but here's a little bit of what he had to say.
I would expect all men to be open to their partners about if they are living that double life, much what you just talked about. And then I urge all women, because it's especially African American women, when you think of that, it is the #1 killer for those women ages 25 to 35, and those are young women. So women gonna have to really take charge of making sure that their partners are wearing protection.
Interesting. So he's saying men have to stop living this double life, and that women also have to demand that men protect, or that they use protection during sex. Would you say those are the two?
All of that.
Okay.
All of that throughout our society, and certainly in the African American community. You know, we have promiscuity, we have infidelity in American society, and it's true in the African American community, and we have to take more responsibility for our lives and our families, and women do. African American women, again, represent 70% of all the new AIDS cases. We're going to have to step outside of the box and step up to the plate and make sure we do everything we can to protect ourselves.
And you're working on a number of pieces of legislation. One is I want to ask you about the Routine HIV/AIDS Screening Act of 2006. It says to require individual and group health insurance coverage, plans to provide coverage for routine HIV/AIDS screening. What exactly are you asking for?
I'm asking the insurance companies to pay for the testing. We need to get testing. 25% of those who are infected don't know that they're infected. So 2007 has to be the year of the test. People have to get tested. We've got to encourage it. I was with Magic Johnson this morning, and he's got a program where he's doing outreach to get people tested. People were standing in line. They were listening to what Magic Johnson had to say. So we've got to get people tested. There's some new CDC guidelines that will help to support routine testing in clinical settings, and then we've got to have the money to pay for the care for those victims once they get tested and find out that they're infected with HIV and AIDS. So that's what that bill will do. It will force insurance companies to pay for testing just as they do for diabetes and cholesterol and other kinds of general testing when one goes in for a checkup.
Congresswoman Maxine Waters, thanks for your time.
You're welcome. Thank you.